Assalamualaikum warahmatullahi wabarakatuh, and very good morning, everyone. In this lecture, I'm going to talk about the lymphatic system. Okay, this will be the objectives of this lecture. Number one is I'm going to introduce you to the lymphatic system and talk about the formation of lymph and its circulation, and what are all the components of the lymphatic system. And number four is the structure and function of lymphatic organs. Okay, before we begin, I'd like to show you one video about the introduction of lymphatic system.
The lymphatic system is a multifunctional body system. Its roles include transportation of lymph and combating infection. The components of the lymphatic system include lymphatic vessels, lymph nodes, and lymphatic organs. Lymphatic vessels form an extensive network of thin-walled vessels that transport lymph around the body, eventually emptying it into the venous system. Lymphatic vessels contain numerous valves and have a beaded appearance, bulging between adjacent valves when filled with lymph. Lymph nodes are small masses of lymphatic tissues situated along the course of the superficial and deep lymphatic vessels. Their function is to filter lymph as it passes through the lymphatic system en route to the venous system. Lymphatic organs are structures that produce lymphocytes and include the spleen and the thymus gland. Lymphocytes are white blood cells which circulate in the bloodstream and lymphatic system and are concentrated in lymph nodes. They are components of the immune system and have a role in combating infection.
All right, thank you. I hope you understand the very quick overview about the lymphatic system. Okay. Okay, what is the lymphatic system as a whole? Okay, the lymphatic system consists of lymphatic cells, lymphatic tissue, and lymphatic organ. For the lymphatic cells, there are T lymphocytes, B lymphocytes, they are all white blood cells and natural killer cells. Well, for the lymphatic tissue, you have the structure called mucosa-associated lymphoid tissue, or MALT. And then there are organs, the lymphatic organs, which are thymus, lymph nodes, spleen, and tonsils. Overall, the function of lymphatic system is to protect the body from invasion and damage by microorganisms and foreign substances. Okay, and before I talk about the formation of lymph, I've got to introduce you why is there is lymphatic system. Okay, lymphatic system is analogically called the middleman between the blood, okay, the blood and the body tissue. Okay, this is the blood in the vessels. Specifically, it is in this area, it is called capillaries. Okay, these are all capillaries. Okay, artery, arterial, and the smallest version of artery is called capillary. All right. Okay, while the body tissue is the tissue outside the capillary. Okay, they are all bathed in the tissue fluid. That is what we call interstitial fluid or blood plasma. Okay, this is where the oxygens or gases, the nutrients, hormones, and small proteins from the blood in the capillaries and the waste products from the tissue exchange, okay, at this level. Okay, the fluid that is diffused to the tissue surrounding the capillary is called the interstitial fluid that I explained before. Okay. It is approximately about 20 liters per day of fluid that is diffused out of the capillary. Okay, in a day, all right? Okay, but the blood returned back to the venous is about 17 liters per day. So what happened to the rest of the fluid? So the rest or the excessive fluid become the lymph. Yeah, they will be absorbed or diffused into the lymphatic capillary. They become the lymph. So it is lymph. The lymph is basically the excessive interstitial fluid from the body tissue that has not been reabsorbed back to the venous. That is lymph. Okay, and they are absorbed to the capillary of lymphatic vessel. Okay, it's the lymph. Okay, it's excessive interstitial fluid. They become lymph. All right. Okay. What about the lymphatic circulation? What is the difference between lymphatic circulation versus the blood circulation? Okay, I think all of you know how is our blood circulation look like. Okay, the deoxygenated blood will be pumped in, return back to the right atrium and pump into the right ventricle and pump to the lung for the gas exchange, so that the high oxygenated blood will return back to the left atrium and left ventricle before it pump back to the rest of the body for the purpose of enrichment. Okay, this type of circulation is called a closed loop circulation. While for the lymphatic circulation, it is an open loop circulation. Okay, when you look at this here, this is at the tissue level. The lymphatic capillaries begin here. They are just an ended endothelial. They just start here and then flow in the lymphatic vessel, lymphatic nodes, and lymphatic trunk before it return back to the veins through the lymphatic duct. Okay, so this is what we call an open loop. So they are just open circulation. Open because they are not returned back to this part. Okay, I hope you understand. Okay, what are all the components of the lymphatic systems? Okay, it consists of lymph. Okay, lymph, I just explained you just now. And then you have lymphatic vessels. Lymphatic vessel is this one. Okay, the vessels that includes the capillaries, the trunk, and the duct. And then you have the lymphatic nodes and other lymphatic organs. The thymus, the spleen, and the bone marrow, and also the tonsil. These are all the components of lymphatic system you have to know. Okay, about the lymph, okay? How the excessive interstitial fluid from the body tissue just now that I showed you in the previous slide enter the lymphatic vessel, okay? It is by the presence of the hydrostatic pressure in the interstitial fluid. Okay, in the lymphatic vessel, to be specific, the lymphatic capillary, the pressure is lower than in the body tissue. This will cause the blood, the interstitial fluid, enter the lymphatic capillaries. Okay, how is the lymph in the vessel flow? Okay, the concept of the lymphatic flow is actually the same as our vein. Okay, they are largely by outside force. They don't have their own pumping like heart. We have heart to pump all the blood, but the lymphatic vessel, they are largely by outside source. Except for some of the large lymph vessel, they might have smooth muscle contraction, but only in large lymphatic vessel. But most of the time they are by the outside force. Like for instance, there's contraction of skeletal muscles surrounding the lymphatic vessels, And arterial position means artery, the position of artery, the nearby artery, that will cause the flow of the lymph in its vessel, and then changes in intrathoracic pressure. This will move the lymph in its vessels. Okay, lymphatic capillary. What is lymphatic capillaries? Okay, this is the lymphatic capillaries. They are closed endothelial tube that are permeable to the fluids and high molecular weight compound. Okay, they are present in most of the tissue except in the brain. Okay, yeah, what you see here is actually the superficial. They are not present in the brain. They don't have lymphatic capillaries in cartilage, bone marrow, splenic pulp is in the spleen, and they don't have lymphatic capillaries in all the vascular structure. You know what is a vascular structure? The structure that don't have any vessels. Okay, for example, the nail, the cornea of your eyes, and then hair. The lymphatic capillaries join to form the lymphatic vessels. The lymphatic vessels, small capillaries join to become the lymphatic vessel, which is bigger than capillaries. They are distributed throughout the body like the veins. Okay, now we go to the lymphatic trunk. Okay, these are all the lymphatic trunk. Okay, you can see the jugular trunk. You can see the jugular trunk. You have the subclavian trunk and left bronchomediastinal trunk. Okay, this trunk drain lymph from the large region of the body. Okay, so for instance, for the jugular trunk, they drain lymphatic fluids from the head and neck, while for the subclavian trunk from the upper limbs, intercostal trunk from the upper part of the thorax, and bronchiomediastinal trunk from the viscera of the thorax. Viscera means organ, yeah, the lungs, and all the structures surrounding it. And then intestinal trunk, obviously from the visceral of the abdomen, organs of the abdomen, and the lumbar trunk. The lumbar trunk, okay, is from the lower limb, lower abdomen, and pelvic. So if you know all the trunk, all this trunk, and where they drain, you obviously know the lymphatic drainage of any of organ of the body. Okay, they are drained by region into this trunk. Okay, lymphatic duct. Lymphatic duct is the bigger vessel. There are only two lymphatic duct. The right lymphatic duct, so the right lymphatic duct here, the right lymphatic duct, and the thoracic duct. Yeah, this is thoracic duct. Okay, thoracic duct is the biggest thoracic, biggest lymphatic duct. They drains from the all part of the body. You can see the yellow shade area is drained by the thoracic duct. While for the right lymphatic duct is smaller than the thoracic duct, because they only drain from the right half of the body above the diaphragm, only this region. Okay. Okay, that is all about the lymphatic vessels. Now we go to the lymphatic organs. Okay, before I go into details about all the lymphatic organs, there are the lymphatic organs can be divided into two. Number one is primary lymphatic organ, and number two is the secondary lymphatic organ. The primary or central is the site of lymphocyte development and maturation, and some of them just maturation. Okay, for secondary, which is the peripheral, is the site where the immune responses occur. Okay, for the primary or central, the thymus is the site for T cell maturation, and for the bone marrow is the site of B cells development and also maturation. While for secondary, there are lymph nodes, okay, the tonsils, the spleen, and also MALT, M-A-L-T, which is mucus-associated lymphoid tissue. Okay, I'm going to talk about the thymus first, okay, the thymus. Oh, before I begin, okay, these are all the lymphatic organ. Okay, there are spleen, thymus, tonsils, many tonsils here, the lymph nodes, and appendix is one of the lymphatic organ, and the bone marrow. Okay, okay, the thymus. Okay, the thymus is a lymphatic organ. They're located behind the menobrium of the sternum. So in case if you don't know where is the menobrium of the sternum, so this is the sternum. So it's called the chest bone. Okay, this is the sternum. Okay, this is the menobrium part of the sternum. So behind this menobrium, there is thymus. Okay, there is thymus. Okay, the thymus is located exactly anterior to the heart and the great vessels. Okay, this is the great vessels. The IVC, sorry, IVC. The vena cava or the aorta, you know that. So the thymus is located anterior to that great vessels. Okay, the thymus, it has many lobules. It's many lobule that is enclosed well within the capsule. Reach its maximum size at puberty. And after that, it shrink. Okay. Adult thymus is smaller than the prepubertal thymus size. The thymus is fully formed and functional at birth. Okay, it persists as a large organ until about the time of puberty, when T cells differentiation and proliferation are reduced. Most of the lymphatic tissue is replaced by adipose tissues. This is what we call involution. But this organ can be re-stimulated under conditions that demand rapid T cell proliferation. Okay, now the bone marrow is where the B cell maturation site for. Okay, this is bone marrow. Okay, the bone marrow is located in the bone. Okay, for instance, in this picture, it is in the long bone, the femur. Okay, this is the femur. We can see this is the marrow is within the bone. Okay, this is the bone marrow. They produce B cells, which one type of the lymphocytes. Lymphocytes is white blood cells, and the B cells produce antibody molecules that can latch on and destroy invading viruses or bacteria. Okay, now we go to the secondary or peripheral lymphatic organ. Okay, number one is lymph nodes. Okay, lymph nodes. Lymph nodes are small. They are small encapsulated bean-shaped or oval-shaped organ. They are located along the lymphatic vessels, okay, in various regions of the body, and they can be found superficial and deep. They are most prevalent in axilla, the groin here, along the great vessels of the neck, the thorax, and abdomen. The functions of the lymph nodes is to filter lymph, to remove bacteria and other foreign substances, and to maintain and activate T and B lymphocyte when needed. Okay, these are all the location of lymph nodes by region. Okay, lymph nodes of the head and neck. Lymph nodes of the head and neck can be divided into superficial and deep group. For the superficial group, there are quite a number of superficial group, but I can only list it here. 4 of them. Okay, parotid lymph node. Parotid means at the side of your cheek. Okay, parotid lymph node. Submandibular below the mandible, and submental below the this chin area, and then superficial cervical lymph nodes is at this. Okay, all these lymph nodes, once if there is any infection occur at the superficial or any part of the head and neck, they can be actually palpated. Okay, when you have fever and or for instance you have upper respiratory tract infection, and the doctor will check for the presence of any cervical enlargement. Okay, and then deep group, one of it is deep cervical lymph nodes, which is present at the side of the jugular vein. And then you have the lymph nodes of the thoracic region. Okay, they can be divided into parietal lymph nodes. They drain the thoracic wall and surrounding structures, and the visceral lymph node that drain the internal structure of the thorax. And the lymph nodes of the shoulder and upper limb drain into the axillary lymph nodes. There's actually several nodes here, but they ultimately will drain into the axillary lymph nodes. And lymph nodes of the abdomen and pelvic region can be divided into aortic lymph nodes, celiac lymph node, superficial mesenteric lymph nodes, inferior mesenteric lymph node, and iliac group of lymph nodes. Lymph nodes of the lower limb we drain into the inguinal lymph nodes. Okay, lymph nodes. Okay, this is lymph nodes histology. I'm not going to talk in detail about histology, but just a bit of it. Okay, lymph node is surrounded by connective tissue. Okay, this is connective tissue capsule. Okay, it's dense connective tissue. Extending from the capsule, you can see extending from the capsule are the connective tissue septa. Okay, this is what we call the trabeculae, and the convex surface. This is convex surface receive afferent lymphatic vessel. This means vessel from the lymph from the lymphatic vessel enter the lymph nodes at this surface. This convex surface. Okay, semuanya masuk ke sini. The lymph and the concave surface. Well, you can say this is a hilum. It has a hilum and it's site for exit of the lymph. Okay, lymphatic, but it is the entry for artery. All right. Okay, now we go to the tonsil. Tonsils are organ composed of aggregates of lymphoid tissue and completely encapsulated, lying beneath and in contact with epithelium. They contain lymphoid tissue and lymphoid follicles. We have three types of tonsils based on their location: palatine tonsils, pharyngeal tonsils, and also lingual tonsil. Okay, the palatine tonsils, okay, this is one of the tonsils. So when the doctor check for your tonsil, you will be asked to open your mouth so that they can visibly see the palatine tonsil. To be exact, is the palatine tonsil. If it is enlarged, it will be enlarged. Okay, enlarged and red. If it is, if there is an infection in the upper part of the respiratory tract, so upper part of the region. Okay, if this region, so if the doctor say, okay, your tonsil is enlarged, okay, that's mean the doctor is referring to your palatine tonsils. Okay, the palatine tonsils are exactly to be exact, is located in the lateral wall of the oral pharynx. It's located quite back. Okay, it's lie between the palatoglossal fold and palatopharyngeal fold. Palatoglossal fold and palatopharyngeal fold. This fold. All right. Okay, this is the palatine tonsils with the folds, palatoglossal and palatopharyngeal. fall or arch. Okay, now we go to the pharyngeal tonsil. Pharyngeal tonsils is a single tonsil situated in the roof of the pharynx. So, okay, if you don't know, this is the pharynx. Okay, this is the nasopharynx, this is oropharynx, and this is the laryngopharynx. Okay, the laryngeal tonsil is located at the nasopharynx or the roof of the pharynx. So this is where the lymphoid or lymphatic tissue is present in the pharyngeal tonsil. Okay, while for the lingual tonsil, lingual in anatomy is referring to the tongue. Okay, lingual tonsils, they are located at the posterior third of the tongue. So this is our tongue. The posterior third is here. So the posterior third, 1/3, and anterior 2/3 of the tongue is actually bordered, is divided by the sulcus terminalis. So the posterior 1/3, there is lingual tonsil. Okay, this is the lingual tonsil. Okay. Now we go to the mouth, mucosa-associated lymphoid tissue. Okay, they are also known as diffuse lymphoid tissue. They are non-encapsulated. There's no capsule. Cluster of lymphoid cells or as lymphoid follicles in mucosa and submucosa. They can be present in digestive tract, genitourinary tract, and also nasopharynx. Okay, nasopharynx. Okay. If it is in the nasopharynx, that is called the nasopharynx. NALT. Sorry, this is I didn't. This is supposed to be nasopharynx associated lymphoid, NALT. Okay, sorry, NALT, and then you have the BALT, the lymphoid tissue in bronchus, and which is known as B bronchus associated lymphoid tissue. There is a GALT, which is located in gastrointestinal tract or gut associated lymphoid tissue. And also in the gut, there is Bayer's patches. Okay, and some of the tissue are there present in the appendix. You know, appendix is at the large intestine cecum. There is a structure called appendix. Okay, when you here the person is having appendicitis that needs removal, so that means that the appendix is infected, that need to be removed. Okay, then the person needs surgery to remove that appendix. Appendix is one of the lymphoid organ. Okay, function of the MLT is to intercept antigen entering this tract, then initiate immune response. Okay, the last organ is spleen. Okay, spleen. Okay, this is spleen. Spleen is the largest lymphatic organ. It's located beneath the left half of the diaphragm, close to the 9, 10, and 11 ribs. They are supplied by splenic artery, a branch of celiac artery. Okay, this is how it looks. Oval-shaped organ, reddish in color. It has hilum. Okay, this is dia punya convex. So this is the concave part. The concave part there is hilum, where the site of entry is the splenic artery, vein, nerves, and lymphatic vessels. Okay, the spleen and a normal spleen will not be palpable. Okay, this is how it looks. They are really deep. They are located posterior to the stomach. So there is no way we can palpate spleen in the normal spleen. But if the spleen is enlarged, that means it's really, really large. Okay, there is a case where we can palpate the spleen in patient with thalassemia or any hematological disorder. Okay, they must be double in size before we can actually palpate it, before it can actually passing the border of the costal margin. Okay, this is the costal margin. Okay. So this is the spleen, is located posterior stomach. In this picture, the stomach has been removed. So when we remove the stomach, then we can see the spleen. Okay, and the major function of spleen is to initiate the immune response to antigens in blood. Number one. Number two, removal of age and defective RBC. Okay, and then the storage place for the new RBC, and iron salvaging, storage, and recycling function. Okay, I think that's all. I wish you thank you for your attention and all the best.